When we think about the risks of pregnancy, our minds immediately go to the hospital room. We picture sterile environments, complex machinery, and teams of specialists monitoring every heartbeat and vital sign. We are trained to worry about biological failures. The medical system prepares expecting mothers for the dangers of preeclampsia, severe hemorrhage, or sudden blood clots. But recent data presented at the 2025 Society for Maternal-Fetal Medicine meeting contradicts those expectations. A non-medical, societal factor is killing more expecting mothers than traditional physiological complications. This chart compares the primary causes of maternal mortality. While the healthcare system focuses on hemorrhage and infection, those figures are small compared to this bar representing homicide and suicide. These are the leading causes of death for pregnant women in the United States. This statistical reality requires a reevaluation of how society and the medical community define maternal risk. We have built an advanced system to protect women from their own bodies, while the external threats remain largely unaddressed. To understand this trend, we have to look past the physical changes of pregnancy and examine a mother's immediate domestic environment. Pregnancy creates a period of intense structural vulnerability. A primary driver behind these homicide statistics is a pattern known as intimate partner violence escalation. The arrival of a child changes the dynamics of a relationship. Shifting power balances, financial stress, and the redirection of attention can turn domestic friction into severe physical abuse. Running parallel to this is a psychological crisis. Perinatal mood disorders, intense fluctuations in brain chemistry, can create sudden, overwhelming periods of suicidal ideation. Pregnancy acts as a stress test. It identifies and expands pre-existing fractures in a mother's emotional support system and her physical safety at home. A domestic dispute or a mental health crisis is a dangerous situation, but the final outcome often depends on what tools are available in that moment. The survival rate of mothers experiencing domestic abuse or severe depression is closely tied to one variable: access to a firearm. This visualization compares maternal mortality trends based on state policy. On the left, states with strict firearm laws show a lower mortality trend line. On the right, states with loose firearm legislation show a significantly higher rate of maternal death. When a firearm is present during a domestic dispute, the likelihood of a fatal outcome rises sharply. The presence of the weapon itself is what determines whether an assault ends in a homicide. In mental health crises, the effect is the same. Suicidal ideation is often a brief, temporary state. Immediate access to a firearm removes the window of time needed for a friend, family member, or doctor to intervene. The findings show that the legal framework for firearm access is a measurable factor in maternal survival. A temporary domestic or psychological crisis becomes a permanent fatality when local legislation permits immediate, unregulated access to a firearm. Modern maternal health care has a limit. Doctors can treat physiological symptoms, but they cannot treat a dangerous environment. Releasing a medically healthy mother into a high-risk domestic environment often undermines the success of her clinical care. This makes strict firearm legislation a necessary form of maternal medical intervention. The SMFM 2025 data suggests that implementing specific waiting periods and access restrictions targets the primary cause of maternal death. Policy changes act as a systemic shield, addressing the danger zones that exist outside the hospital walls. Protecting expecting mothers requires us to expand the definition of healthcare. We must treat the laws governing a mother's safety with the same urgency as the medicine treating her body.